Good evening, ladies and gentlemen, friends and colleagues from the dental fraternity. My name is Ruben. I once again invite you to yet another wonderful session from the continuation of the dental webinar series presented to you and brought to you by DentistChannel.Online. I hope you all are doing well and you're all geared up to learn something about aesthetic and cosmetic dentistry. Today we have with us once again Dr. Jonathan Rao, a person who's been associated to us since a while. He's been conducting houseful success houseful and successful dental workshops in these tough times of the pandemic. A lot of students have been benefiting. Very soon we'll be giving you information on the upcoming workshops that we've planned with Dr. Jonathan. Dr. Jonathan is one of the most well-known aesthetic dentists from Bangalore. He's not just an aesthetic dentist, he's a cosmetic dentist. He's an implantologist, a dentist who has multiple feathers to his cap. Without much further ado, it's now time that I invite Dr. Jonathan to present and share his thoughts and all that he's done on veneers. Over to you, Dr. Jonathan. Thank you.
Thank you, Ruben. So this evening, I'm once again thankful to DentistChannel.Online for giving me this opportunity when I can share something about what I've picked up over the years. And today, as we all know, it's a very interesting topic. We're talking about porcelain laminate veneers. Is it a predictable restorative option? You see, the porcelain laminate veneers are always a very, very attractive treatment option to everyone. And everyone wants to know how to do it. And yes, we are going to help you in that journey over a period of today's webinar and upcoming webinars which are coming up. But before we understand about anything about aesthetic dentistry, I think we all about laminate veneers, we have to know the basis, and that is aesthetic dentistry. And as we all know, we are more of aesthetic dentists rather than cosmetic dentists, because we have to try to reproduce the natural appearance and function of the teeth and the surrounding oral structures. And I think that is what we need to look at as dentists. And if you all know about aesthetic dentistry, then you all definitely are practicing adhesive dentistry that involves the bonding of the natural substances, which is enamel, dentine, along with the restorative material, which can be of various varieties. Now, before we understand a little bit about adhesive dentistry, the whole important thing about how to plan a case is what I would like to stress on before we actually go into what we're going to do with veneers. Because as I always say, treatment planning is the key to good long-term success in aesthetic dentistry. As we all know, aesthetic treatment is very subjective. There's a lot of active patient participation compared to other treatments. For example, a root canal, when you do, your patient really does not participating too much in the treatment plan which you give him or her. But whereas in aesthetic dentistry, you have a team working together, and which the patient is an important part of the team. So the color, the characterization of the restorations are very much open to scrutiny by the patient, their family, their friends, and therefore we need to adopt different protocols to meet these challenges. And that is picked up by learning, by studying, and by experience. Now, to execute aesthetic treatment plan successfully, we need these 5 important factors. One is time. Without time, we can do nothing. Aptitude is basically how we are able to pick up knowledge and use our innate abilities. Knowledge which we pick up through webinars like these, books, journals, skills that we practice over a period of time, and finally, the experience. When we have a good mix of all these, we're able to give and present to our patients successful treatment options. Adopt the pace of nature. A secret is patience, says Ralph Waldo Emerson, one of the great poets. He said, adopt the pace of nature. What is the pace of nature? How fast do we grow? How fast do we learn? It doesn't happen overnight. It takes time. And this is part of the journey. And when we try to offer something very quickly to our patients, we may not get the best results that we want. Initially, we always begin with something like the assessment. Now, assessment of a patient is the first consultation. Now, the first consultation, as we all know, is very, very important. It is the clinician is making their decisions, the patient is making their decisions. You're basically looking into each other's personalities in that short period of time. The patient is assessing whether she or he is confident in your team, and you are assessing whether she will be or he will be a good patient for you. So as we all know, we start with basic things like, you know, our medical history. We get to know different factors, their socioeconomical uh, categories, the environmental hazards, their disabilities, their habits, their nutritional history, their dental history, their phobias, etc. We all find this out during history taking. Many times we go straight to the problem, but we do not ask this. And then later during the term of treatment, we see that many times that the patient is not very happy. And this is because we don't take time to take this initial history. Of course, there will always be people here and there who make life difficult for us, but that's part of it. Now, in an aesthetic patient, especially if you're going to go in for treatment like porcelain laminate veneers, we need to look at how we are going to present it to our patient. Now, many times a patient will come to you just saying, I have this discoloration on this left tooth. Can you correct it? Now, if you're just going to look at it from that point of view and then say, okay, I'm going to do something and then give it to them, they may not be as appreciative as if you take some photographs, you're able to exactly match the shade, you're exactly able to decide what type of restoration you're going to give them. And hence, when you do that, you will also be able to give a better result to your patient. And hence, I always like to make sure that I take few photographs. It doesn't have to be too many, but at least 10 or 12 photographs, which will give me an idea of what I'm looking at. Because this will give me a good before and after picture, as well as it will also give me an ability to learn from my mistakes. As we see here, we take the extraoral photographs, we take the aesthetic photographs, and I will be going into detail about some of the things that is necessary. Now, as we do the intraoral uh, examination, we see maybe there is tooth wear, there is attrition or abrasion, or maybe even abfractions, or maybe some fractured teeth. All these things we find out. Many times we might ignore them if we don't take photographs. We go back home, we look through our camera or our computer or our phone, and then we see, oh yeah, these things are also there. I should have told it to the patient. So I think that this is why photographs are very important. We basically start all treatment with an aesthetic analysis. So you do a facial analysis, you do a dentolabial analysis, a phonetic analysis, a dental analysis, and a gingival analysis. Now these five analyses make up good aesthetic analysis. Now, especially if you're doing a full mouth rehabilitation, you will need to look at all this in detail. Now, these are some of the photographs that I take just to make sure that I get some good results. And as you see here, you see some the, the photographs at smile, at medium smile, and when the patient is smiling uh, to the maximum. Take it at a lateral view at a 45-degree angle. And then I see the basic 1/3 of the facial symmetry to make sure that I'm able to get that. Look at the nasolabial line to see if there is any prognathism. And then a close-up of pictures at smile and see the amount of teeth that are exposed, the amount of teeth that are missing. What can I do? Maybe there's a little bit dark corridors at the buccal aspect. Looking at all these things, we take this. The other factors that we also analyze is the length of the incisors. And we also look at the lip lines. In this factor now, especially when we're looking into veneers, the lip line is extremely important in how we are able to look into the patient. Now, for example, a patient with low lip line, the aesthetics can be compromised. It should not be compromised, but yes, it can be compromised. You make a little mistakes with the shade, it might not really matter. But when you take a medium lip line, you have to be absolutely perfect. And with a high lip line, there is no room for error, absolutely. The other very important thing, which was recorded in the 1950s itself, was the display of the central incisors varies according to the clinical aspects, maybe the patient's age, the patient's gender, the character, and the length of the upper lip. Taking all these into consideration, we make a decision on how we're going to go about with our final restoration. Now, on an average, the amount of exposure in a woman is about 3.4 millimeters, and in a man, it's about 1.9 millimeters. So let's say on an average, 3 and 2 millimeters. So this is what gives us an ideal amount of height, once again, depending on the age of the patient. But if you're looking at a younger patient, of course, this is what we will look at. And when we look at the elderly versus the young, we see the difference almost of about roughly about 2 millimeters. So if you're doing an older patient, say who's in her late 50s, you would not want to have 3.5 millimeters exposure of the incisal edge. You probably would look at something in the range of about 1.5 to be age appropriate. So this is one of the very important things which many times is neglected in the basic initial analysis which you are doing, aesthetic analysis. Another thing that you will also take into consideration is, of course, the smile at rest and the smile at the maximum smile. You will look into that. You will see the tooth proportions. Maybe you're seeing the teeth are a little bit more square. Maybe there's a little bit of wear on one or two teeth more than the others. So you're taking all these things into consideration. Now, on an ideal amount, we need to have our proportions more or less at a very, for example, a central incisor of a male who's in his 30s should be the length of about 10 to 11 millimeters. Whereas if you're looking at restoring a woman who is in her 20s, you will have to be looking at something of a similar height but with more exposure on the labial aspect. Another thing that we also take into consideration with existing either restorations or existing dentition is the amount of the midline that is exposed. Now, looking at all these things, now I've given you a quick rundown of all the things that are involved in looking at the aesthetic analysis. There is so much more to this. Of course, in our upcoming courses, we are going to go in much more detail about the smile analysis. We are going to go in much more detail about smile design, digital smile design, and other smile design programs that are there available for us to give our patients amazing results in a shorter period of time than the traditional way. So once again, I would like to stress the importance of treatment planning. Any one step that you miss in this might end up not in a failure, but might end up in you spending a little bit longer time on the patient, a little bit more explanation to the patient when you need not have, maybe you have to do something which you did not plan earlier because you did not sit and plan for it initially. Hence, treatment planning, I cannot stress enough the importance of treatment planning when a patient comes in looking at an aesthetic change. Now going to the topic that we all are here for. Without the planning, we cannot come here, and now we have come here. So porcelain laminate veneers, what are they? They are one of the most conservative aesthetic treatment options when restoring the mouth for improved aesthetics. Now this has been in dentistry since the early 80s. And the longevity of veneers are good, they're durable, especially if they are applied in the right indications. The correct techniques when they are applied, then they are extremely wonderful treatment options that can be presented to your patient. We are asking, is it a predictable option? Of course it is a predictable option. But the important thing is for us to use it with the right indications in place. The fundamental concept in any restorative case is to keep it simple, to concentrate on one important objective, and that is to conserve the tooth structure. As you see here in the picture below, you see that the amount of preparation that is there is at the least very minimal. If you look at the initial photographs in this, which maybe I will show you later, you will see that I've hardly prepped. And this is so important if you want to do good porcelain laminate veneers. And if you have the basic principle of conserving sound tooth structure. I always use this slide which says the best full crowns are the ones that you will never do. And which basically means this, that you need to start looking at more conservative treatment options rather than your regular full crowns. I'm not saying that full crowns are bad, they have their place, but where there is an option, look at the more conservative option. As we see, complete crowns, they require very invasive preparations. They can range from almost 75% of the tooth structure which is removed, which is a lot. Whereas if you're preparing for a veneer, on the other hand, you might be preparing almost 14 times less. Now that's a lot. Say I'm going to prepare 25% of the tooth compared to 75% of the tooth. It's a lot. And we have to know when to do it. And that is the key. Now, indications for veneers, as we all might already have an idea by now, are when you have stained or dark teeth, hypocalcifications, multiple diastemas, peg laterals, chipped teeth, lingually positioned teeth, malposed teeth not requiring orthodontics. These are some of the indications in which veneers can be done. Cases like this, you see old composites, which are there on the cervical aspect, some on the mesial and distal aspects. Discolored teeth, a single discolored tooth, that is also an option. You see where there is multiple diastemas, broken teeth, fractured teeth. Another case where we have a lot of old restorations, a lot of old composites, and the patient is looking at doing something more definitive. A case post-orthodontia, you see that there's a lot of work to be done. This could be an option that you could offer to your patient. Now, what are the contraindications? The contraindications are insufficient tooth substrate. That means you don't have enough enamel to bond. There's labial version. That means it's buccally placed teeth. Excessive interdental spacing, when the spacing is more than, I would say, 4 millimeters. Anything more than 4 millimeters is a lot in which we're going to do. Excessive interdental spacing, poor oral hygiene and caries. Patient who is susceptible to more caries, veneers is not the best option for them. Where there is parafunctional habits like bruxism, not the best, unless you're going to go in for a complete change in an adjustment of the bite. Moderate to severe malposition or crowding. Wherever there's crowding, veneers are not always the best option. Now, what are the advantages of veneers? Minimal tooth preparation required. Porcelain veneers are stronger and more durable than composite veneers, as we all know. It's an alternate to full coverage restoration like a crown. In case, for example, there's an incisal fracture or there's a discolored tooth, a veneer is a better option. And where there is color stability, of course, amazing. Now the disadvantages. That can be, even whenever I go in for any topic which we go, we have to know the disadvantages too. And that's how we make our case decision. We look at the indications, the contraindications, and then we make our decision. The disadvantages of veneers include the potential for over-contouring, means maybe over-preparation. It requires laboratory procedures, which that means it is going to take a little bit more time. The porcelain enamel margins may be thin and difficult to find, okay? So in which you'll have to take care. The margins may be brittle. When there is fluoride treatment, which can cause acidylated fluoride, these spots which are there in the mouth, in those cases, they are not always successful. It cannot be repaired easily. Once bonded, it is always bonded, and you have to remove the entire veneer, and you cannot just fix it up. And it's very difficult to temporize because of the thickness of the temporary material, which usually is 0.3 to 0.7 millimeters. And the color cannot be changed much once you place it. And of course, the placement is difficult and time consuming. Cementation of, say, 6 veneers can take a little bit more than an hour if you do it in the right way. So these are the disadvantages that are also there. Now we need to balance it out, looking at the advantages and the disadvantages. Take it. As part of the SMILE analysis, this is another thing that we look into when we basically plan out a case for veneers. We need to look at, number one, from a full face perspective. So we are able to see how many teeth are exposed. We're able to see very clearly in this case the type of restoration that we are looking for. We're looking and seeing if there is any old restorations, any tooth that is more labially placed or lingually placed, looking that in detail. Another aspect where you can see here, when you take this 45-degree angle photograph, you're able to see here the old restorations in a little bit more detail. You're looking at the occlusal plane, maybe as you see here, in the second quadrant, the first premolar, on the other hand, is not exactly following the plane of occlusion. So we need to look at that too when we are designing doing our initial treatment planning. Now, the question that always comes is, what if the teeth are not aligned properly? So, as we all know, one of the major indications are when there is space management of using porcelain laminate veneers. But it's not always best to use in case of crowding. So we need to look at, so we are faced with these two problems because we're not able to exactly visualize the aesthetic outcome. And we know that the preparation that we are going to do in crowded teeth are going to be a little bit more. So we need to take care. So hence, once again, I will stress on the treatment planning. At this stage, we have to understand that it is impossible to do this if you're not able to visualize our treatment plan. So the first step towards achieving this is the mock-up. A simple freehand composite can be used, or you can transfer it from your wax up and then transfer a mock-up into the patient's mouth. Now, as we know, it does not need to be completely precise, but is basically to help us get an idea of how we are going to go about it. Of course, I will go into a little bit more detail in our upcoming course, about how we'll be able to exactly get the right height, the right length, the amount of thickness of addition of the material that we're going to add for our final restorations. We also will be able to make a difference and see if you, for example, you have the incisors too long, it might have a great effect on phonetics and on speech. Hence, we need to look at every single aspect before we make a final decision. As we all know, mock-up is an amazing tool which can be used. Okay, it is done by the lab technician or by you. And at the end of the process, we are able to share what the lab technician has done and transfer it to the patient's mouth. Now wax up done like this, for example. So now the wax up is then applied to the tooth structure with the provisionals. The techniques is basically by either using a transparent silicone index or a regular silicone index from the wax up, and then fill it with flowable bisacral. In other words, maybe your pro temp or your cool temp, then place it on the unprepared teeth. The margins are slightly trimmed to create that natural effect. And then you are able to see how the final restoration is going to look like. Now, the lip support you're taking into consideration, the functional movements of the patient, the phonetics, all these things are evaluated. And then we go about the tooth preparation. We go using the mock-up as our preparation guide, we go about this. Of course, you have to do a three-plane technique, just like how we do for all teeth preparation. We have to look at a three-plane technique and give us the right kind of way in which we can prepare the tooth structure so as to be conservative for our patients. And then we do our finally we prepare the incisal aspect so as we know how much we're going to add, how much is going to be removed, etc. This is a tooth that is finally prepared. For example, in this picture here, tooth 1-1, ready for impressions and shade taking. Impressions are taken, and then we manufacture the temporaries. We will be showing you in the upcoming courses videos and live demonstrations of how we will be able to do it and exactly transfer it into the patient's mouth. And you will do the trial once work comes in from the lab. Make sure that it's matching. If there's any error, you have to do it, because once bonded, veneers are very difficult to remove. We always begin with absolute isolation. Without proper isolation, adhesion is always compromised. Now, I would like to share with you one case. And this case is very dear to me because this was my first case of porcelain laminate veneers. As you see, we had a 65-year-old lady who had old restorations and wanted new smile. As you see here, some of the basic analysis that was done, we see that the smile line, look at the width of the smile, it's almost premolar to premolar. The interincisal line coincides with the midline. So taking all these factors into consideration, she was undergoing other treatment too at that point of time. She was actually getting, she was having a very bad temporary which was placed there, and she wanted to get that changed. In that process, also to get some implants done. But we needed to look at all those things because she was very worried about the way in which her front teeth looked. As you see a close-up of the picture, you see class 5 composite restorations that were there, which needed to be changed. And she was basically very unhappy with the discoloration. An ex-smoker who has been smoking for more than 20 years, and she wanted a completely new start in life. So we started with first doing external home bleaching to improve the shade, to see how we will be able to improve it. So from about a 3.5, we were able to bring it to almost a 2, except for the discolored composites that were there. Quick mock-up was done from the wax-up that was done. We did a tooth preparation, always checking it with our silicone index, verifying it, breaking the interproximal contacts in this case because of a lot of the old restorations that were there. Finally finished and polished. And as you see, there are a lot of old composites restorations. I will be going in detail in our course about how we can, why using old composites or changing these old composites while doing porcelain laminate veneers is very important. We verify every time with the silicone index to see sometimes we may have over-prepped, sometimes we may have under-prepped. Look into all aspects so that we are able to give the lab technician enough of room for him to prepare the veneer, especially when you're looking at a color change. We verified it with our silicone index. This was immediately post-prep, ready for impressions. We provisionized the patients once again. And these were feldspathic ceramic veneers which were done. It's a type of glass ceramic, very good aesthetics. It was ready for the try-in. We tried it on. Patient was more or less satisfied with it. And then we begin our cementation procedure. We pre-treat the veneers. There's absolute isolation in this case to make sure that we are able to, the margins are exposed, we are able to make sure that it is cemented perfectly. Etch it, prime it, bond it, and then cement it. And this was immediately post cementation. As you can see, when we use a rubber dam, there may be a little bit damage to the gingiva here and there, but that is okay because we were able to get absolute isolation. And you see, after that, we about 10 days later, post cementation, we were able to get a result like this. Not the most perfect case, not the most aesthetic case, if you look at it like that, but very natural, considering the fact that what we were looking at trying to achieve for a person in her 60s, late 50s, early 60s, the kind of result that we were looking at. She was satisfied with her smile at the end of this. Now, if we were able to achieve this, I think, yes, we would have achieved the result that we want to achieve at the end. Now, many of you will be asking, how is the success rate of porcelain laminate veneers? Very, very successful. Approximately, we see that there is hardly about, there's about 5% failure overall. That means a 95% success. Okay, this was done over 12-year study, which was done, and using this analysis, they were able to see that it is a highly successful. And today we have 15-year, 20-year studies which are there showing the success of this. This study was not just done by one person, it was done by multiple clinicians all over the world. Fradiani, among others, who is one of the biggest names in dentistry. And as you look and see, it was done almost 349 veneers were analyzed, and the amount of success was coming to 94.6, which is very high in case of porcelain laminate veneers. Now, if you want to achieve smiles to change from this to this and make drastic, amazing changes in your patient's mouth, make natural smiles, create natural smiles like these using porcelain laminate veneers. I think you've come to the right place. And I think that we will be sharing with you the details of our upcoming course on laminate veneers in about 10 days, which we are going to conduct. We are going to be having it on the 13th of June. And it'll be a full day course with details on smile designing, on tooth preparation, the types of tooth preparation, your whole bonding procedure, and how to deal with stuff, especially in class 4s and class 3s and other difficult ideas. And also we will be going through a lot of troubleshooting. So this is what we are going to be doing in our upcoming course. And I'm looking forward to seeing a lot of you there. And I hope you had some information today, which is going to help you in your clinical practice. And thank you very much once again for this opportunity to share.
Thank you so much, Dr. Jonathan. It's always a pleasure to see all that you've been doing since a couple of years. I hope a lot of people who joined us start getting into aesthetic dentistry. I think besides implantology, the next big thing in India certainly would be aesthetic dentistry. A lot of people are now looking forward to getting that perfect smile. And what's best than learning the concepts and principles of aesthetic dentistry in these times? Where in your home, you're at the comfort of your homes. All you need to do is you need to have your laptop, sit in front of your laptop, listen to the master, listen to him, get all those brownie points. Of course, this is not a workshop which is going to show you how you're supposed to do hands-on, but those few brownie points are the ones which actually define what you're supposed to do and what you would be doing in the near future when you actually start doing patients in your practice. Saying with that, I'd like to let everyone know that we very soon will be having a question and answer session, requesting you to post in questions and please post them in a way that they are in a question format. Please don't use any abbreviations. It becomes very difficult for us to understand what you're trying to tell us. Moving on, I'd like to give you a gist of what exactly the master classes that is being organized on the 13th of June. Before that, once again, Dentist Channel Online would like to thank you for being a part of this session. If you like this session, please let your colleagues and your friends know who Dentist Channel Online is. We're a dental media company. This is all that we do. This is our daily bread and butter. We love to cater to the dental fraternity. We do a lot of events, workshops, congresses, hands-on courses, webinars, etc., to keep you updated on the latest trends and technological advancements from the world of dentistry. Dentistry is such a overwhelming world, and what's better than connecting all of those through our platform? Uh, all we want you to do is stay in touch with us. This is a number where you can commonly stay in touch with us. We'll add you to our WhatsApp broadcast. All you need to do is you need to save this number on your WhatsApp, and you need to reply back with your full name. We'll add you to our WhatsApp list. We'll be happy to be in touch with you. All you need to do is save this number and reply back with your full name. We look forward to adding you on our WhatsApp broadcast list as well. So Dentist Channel Online, in association with Dr. Jonathan Rao and the Federal Dental Association from Germany, is organizing a series of aesthetic workshops, aesthetic cosmetic dentistry workshops, starting with the first workshop, a masterclass on veneers, a workshop which is going to give you a complete insight on what veneers are, what is the scope of you incorporating veneers in your general practice, how can general practitioners start getting into the field of aesthetic dentistry, because it's commonly said that aesthetic dentistry cannot be done by all. I think which is a myth that you have to stop unfollowing, and the fact is everyone can do aesthetic dentistry as long as you have that eye for fine detailing. I hope I'm right, Dr. Jonathan.
Absolutely.
So friends, we are inviting you to be a part of this workshop. The case which exactly Dr. Jonathan showed in the latter part of his presentation, this is what you are going to give your patients who are coming, who are going to come to your clinic, all by being a part of this workshop. So when is the workshop happening? The workshop is happening on the 13th of June. It will be taking place from 9 a.m. to 5 p.m. It's a power-packed workshop, back-to-back lectures. This is the schedule. So right from smile design, analysis, principles to treatment planning for the anterior sectors, case selections, how getting started with porcelain laminate veneers, the concept of preparations, impression techniques, cementation, case studies, and of course, the most important module that I believe personally is complications and troubleshooting. Because everybody talks about aesthetic dentistry, but no one really talks about what happens when there's a failure, when you start practicing, because in your initial days there is a chance that you might land up in some sort of complications and some sort of failures. So this is the exact module, a power pack module for nearly an hour and a half, which is only going to talk about what kind of possible failures you're going to come across and how to troubleshoot them and how to give the comfort to your patient. So what exactly is the international certification that you're going to get? So the Federal Dental Association is going to provide you a certificate with 8 CPD points. This is a certificate which has a valid lifetime access to the CPD point certification that you'd be getting. Now you might be asking, a complete day of workshop might cost you a bomb, but to let you know, friends, we do understand that it's time of COVID, and we've kept it at a very minimal pricing of 2,999. So all you need to do is you need to find the link in the registration in the chat box. You can register today itself. You're having very limited seats because it's a one-to-one. It's a one-to-one workshop. We won't be able to cater to a lot of people. If you really wish to register, the link is sent in the registration box. You can also find the link in the chat box as well as on events.dentistchannel.online. I repeat, events.dentistchannel.online. This is a workshop, once again, conducted by Dr. Jonathan. This is a complete intensive hands-on workshop. It's a 3-day intensive workshop that will be taking place in Bangalore in the month of July. That is 4th, 5th, 6th July. If you would be able to travel to Bangalore, nothing better than attending this workshop. This is a hands-on workshop wherein right from lectures to doing hands-on typhoid and models, everything's going to be covered in this 3 days of intensive hands-on learning with Dr. Jonathan Rao. Uh, Another feature of Dentist Channel Online is by you being a prime member of Dentist Channel Online, wherein you can avail exclusive discounts on these workshops as well as on all the other workshops that we've planned for you for the complete year. So if you wish to be a part of Dentist Channel's Prime membership, you are requested to visit www.dentistchannel.online. Once again, requesting you to save this number, be in touch with us. We'll be happy to stay in touch with you as well. Then a webinar that is being promoted by Dentist Channel Online is a webinar on the topic basal implants, surgery, and syncrystallization, basically the welding techniques that are used in implantology. It's a free webinar, a power-packed webinar wherein there'll be three speakers who'll be talking on three different topics associated to basal implantology and oral implantology in general. If you wish to register for this webinar, you are requested to visit events.dentistchannel.online. I repeat, events.dentistchannel.online. Thank you so much, friends. It's now time for the question and answer session. Before the question and answer session, we'll be running a short poll. The poll helps us to understand if you are interested to get further details about the workshop, requesting you to kindly answer to the poll. Let's start with the question and answer series. For the first question from Dr. Devyani Allen, who's asking, is the tooth reduction done over the mock-up? Also, what about a reductive case?
Yes, so the tooth reduction ideally should be done over the mock-up when you're doing an additive case. And if you're doing a reductive case, on the other hand, there are different ways in which we can go about it, but we have to understand the amount of dentine that is going to be exposed in a reductive case. So we have to look into a lot of things, and then we need to make our decision. Of course, that's the reason why we need to do a wax up and a good mock-up.
Thank you, doctor. Moving to the next question, a question from Dr. Aisha, who's asking, what is the instrument used for the IPR, the interproximal reduction?
So there are a lot of interproximal saws which are there available. They are depending on the amount of that you need to reduce. For example, you want to reduce say 0.5. It also depends on how on what your lab requires. So you need to look into that. You can use your regular fine burr also if you want to use, but this one gives you a little bit more detail with your interproximal instrument. It's like a micromotor handpiece, which is connected, and it has a special saw that you can, which you can adjust the size accordingly, and then you can.
Thank you, doctor. Doctor, could you kind of give us an insight on what is the kind of investment one needs to do? You know, because when you get into implantology, we all know that it's not a very small investment. It's a big investment that you need to do, even though you're in your very early stages of getting started in oral implantology. Is the same case or the scenario in cosmetic aesthetic dentistry?
Absolutely not. You, I have come to start doing veneers now. I need 3 burrs and my handpiece, and I can use my impression materials. I have a good temporary material, and that's about it. So your investment is minimal. Your your profits can be maximum. Of course, you need to take good photographs and all those things. So there are many things that you need to look into. But the investment comparatively to implants and to other things is very, very minimal. And it's more about understanding the principle behind it rather than the material as such.
Does this mean a person can start in aesthetic dentistry tomorrow itself in their office if they are all equipped?
Yes, if you have the basics, yes. I know that you all have rubber-based impression materials. I know that you all have burrs, and I will be suggesting just 3 or 4 burrs to be done. And you have maybe a good temporary material like a Pro Temp or something like that, and then you're good to go. So it's as simple as that.
Thank you, doctor. Thank you so much. Doctor, moving on to another question. Let's say there is a full mouth reconstruction that's done using veneers, and there are few veneers that are discolored, you know, not all are discolored. So what do you do in this case? Do you remove all the veneers, or do you only remove the ones which are discolored, and do you place new ones? Because then the ones that you will be changing to the ones that have been discolored won't really match to the ones that are intact.
So one is, yes, of course, it's always better to change the entire thing, but it is not always practical because of various things that you look into the patient, for example,
Mainly costs.
especially the cost, the economical uh, considerations that needs to be taken. But if you are working with a good technician and you take good photographs and able to pass the message on to your lab technician, he or she will be able to give you amazing results. You don't need to change everything. So it's about how you communicate your information which you have taken to your patient, to your lab technician, so as to give the result, the final result. Yes.
Thank you so much. Let's say, doctor, there is a patient who is desperately asking you for veneers, but somehow you are not convinced that there is a chance or there is a scope that the veneers might fail. In these cases, what do you do? Because you don't want to disappoint the patient, one. Second, you don't want to lose the patient. What do you do? What is the other option?
I call them full veneers or U veneers, which are basically crowns, which are prepped just like veneers, okay, which are basically prepped to the very, very minimal. And the same thickness as you're going to give on the labial aspect, the same thickness you're going to give on the lingual aspect or the palatal aspect, and give them the same results. And in fact, it is even more long lasting than your regular veneers. So you're doing the same thing, very, very minimal preparation. So you will not disappoint anyone in the process.
Thank you so much. Question from Dr. Alna, who's asking, I want to do a hands-on in Ernakulam, Kerala. Sorry, doctor, we've not yet reached Kerala. We'll be reaching very soon. Uh, Pandemic is hitting us too. All I can tell you is you need to take a bus. You need to drive straight down to Bangalore. We are having a workshop in Bangalore, which is not as far as you traveling all the way to Mumbai or any other city, because you'll be in South itself. So if you happen to be interested about the workshop taking place in Bangalore, get in touch with us. We'll be happy to give you more details. Last question. We have a question from Dr. Meenu, who's asking, do you recommend veneers in deep bite and edge to edge bite cases?
So in edge to edge cases, it's a little difficult in how we are going to manage edge to edge cases. But you'll need to, that's what, once you are able to have your mock up in place, you're able to give this. In this case, I would give my patient a test drive. I would give them, I would say, wear it for about a week and see how how the patient is responding with the new bite. And if I see there's a lot of chipping, there's a lot of breakage of the temporary material in this case, then probably I will say it's not the best option. So we need to charge the patient, of course, for the test drive. But I think that's a very good way of telling your patient also they are able to understand the difference, why we need to go about it in this particular fashion.
Thank you so much, Dr. Jonathan. With that, we come to the end of this evening. Friends, we hope to see you all for the masterclass that is scheduled to take place on the 13th of June. Get yourself prepared. All you need to do is you need to give us your one day, and we're sure that you will end up learning a lot about veneers. Till then, stay safe, and we hope to stay in touch with you as well. Thank you, Dr. Jonathan. Wishing you all a wonderful